Hi, my name is Aeron Sheffield, and this is my doctorate in nursing practice project presentation. My project title is Patient Safety Initiative Ultrasound Technology to Prevent Complications of Dermal Filler Injections. My committee members are as follows: Dr. Rita Wunderlich, my chair and first reader; John Rodriguez, co-owner of the medical spa clinic that the project took place in, and my second reader; Dr. Amanda Boone, MD, my community member and our medical director for the clinic. Regarding the background and significance of my project, the purpose of the study was to evaluate the benefits of ultrasound technology in comparison to the general best practice guideline of aspirating prior to dermal filler injections. With dermal filler injections, providers aspirate prior to laying boluses of hyaluronic acid filler to assess if they have inadvertently accessed a vessel. The study was thought out to assess if utilizing ultrasound technology prior to injecting would decrease said adverse events for patients. This project is comparing a pre-implementation study group without ultrasonography versus a post-implementation study group with ultrasonography. The aims of the study is to evaluate the effectiveness of the ultrasound technology in preventing and decreasing the severity of adverse events in order to improve patient outcomes. When evaluating the literature for ultrasonography in dermal fillers, tons of current literature was provided. However, it was interesting that not a ton of research was done as a preventative measure for dermal filler injections as much as utilizing ultrasound technology as a diagnostic tool for complications like vascular occlusions and providing the ability to assess, diagnose, and treat said complications during an emergent event. Facial dermal fillers are made of hyaluronic acid that is a naturally occurring substance in our body. This hyaluronic acid is not like the ones we utilize as a serum, yet are compounded into a gel form that range in consistencies for different areas of the face to restore lost volume. With injection of dermal fillers, there comes a range of adverse events that can be experienced. These adverse events range from bleeding, bruising, hematoma formation, infection, vascular occlusions, which is where a vessel, either an artery or a vein, is occluded by the filler, and even blindness. Ultrasound technology has been found to be beneficial both as an assessment and diagnostic tool during complications, but also utilized prior to ensure proper vessel placement in patients prior to injection. There is a learning curve to implementation of ultrasonography into a medical spa clinic. These clinics are not using ultrasound technology as frequent as, let's say, intensive care units or any hospital department for that matter. However, with the implementation of ultrasounds into a medical spa clinic, the providers are better equipped to visually see the patient's vasculature prior to injecting and are able to ensure that the patient's safety is maintained throughout the service. The theoretical framework of my project focused around the Lewin's theory of change. Lewin's theory of change focused on three main stages, including the unfreezing stage, moving stage, and refreezing stage. When correlating my project with this theory, the unfreezing stage most resonated with the reassurance and comfort that the ultrasound device provides to the provider and the patient. When evaluating for places to go as a patient, it is imperative to understand the policies and procedures that are in place at the clinic that one decides to go to. If a clinic has ample experience with an ultrasound in clinic practice and is able to explain the use of it effectively, it will alleviate fears of the unknown for patients. It will also provide as a great tool for the provider to ensure that patient's safety. The next stage includes the moving stage. This stage resonated with the implementation of said ultrasound in order to improve patient outcomes. As I talked about in the literature review section, ultrasonography is a powerful tool for medical spa clinics to implement into practice to not only use as a diagnostic tool prior to injecting to ensure proper vessel placement, but also as a rescue tool to assess and treat complications like vascular occlusions. Providers are able to visibly see the vessel and can follow the vessel to evaluate for a possible occlusion of a vessel in order to properly dissolve the filler and restore blood flow to the tissue. The final stage is the refreezing stage. This stage resonated with my project by ensuring the provider understands how to utilize the device in assessing each patient and their unique anatomy. Each person that sits in the chair in a clinic has different anatomy, and with the use of an ultrasound device, providers can properly evaluate any anatomical anomalies to prevent complications from occurring. Regarding the methods and design of my project, I chose to utilize a quantitative retrospective chart review. The study included 308 electronic medical records evaluated between October 14, 2021 through September 14, 2022. 154 of those electronic medical records were done prior to implementing ultrasonography utilizing aspiration as best practice, while the post-implementation group included 154 electronic medical records of patients that obtained dermal fillers but received an evaluation with ultrasonography prior to any fillers being placed. The study utilized a retrospective chart review design to ensure the proper evaluation of aspiration versus ultrasound, and this design helped answer the key research question by providing the data needed to statistically analyze and assess its benefit. The analysis portion of the data was utilized by the software called SPSS, and a statistician helped ensure that the proper tests were utilized in analyzing the nominal data that was provided. The sample for this project was assessed by the data provided on the electronic medical records. No patient identifiers were included in this study, as all of the specific patient identifiers were removed prior to collection of the needed electronic medical records. The pre-intervention group included 132 female patients and 22 male patients. Out of those 154 patients, 38 patients were between the ages 21 to 30, 59 patients were between the ages 31 to 40, 34 of those patients were between the ages of 41 to 50, 15 of those patients were between the ages 51 through 60, and 8 of those patients were between the ages 61 to 70. The post-intervention group included 139 female patients and 15 male patients. Out of those 154 patients, 50 of those patients were between ages 21 to 30, 55 of those patients were between 31 to 40 of age, 30 of those patients were between the ages 41 through 50, 12 of those patients were between the ages 51 through 60, and 7 of those patients were between the ages 61 through 70. As you can tell, the majority of the patients were of the female gender, and most of them concluded between the ages 21 to 40 years of age. This study only evaluated electronic medical records of patients at least 21 years of age. When analyzing the data of this study, Mann-Whitney U tests and Kruskal-Wallis H tests were utilized to determine statistical significance. It was found that the implementation of ultrasound in the post-intervention group was statistically significant in comparison to the pre-intervention group when evaluating the severity of adverse events found. These results concluded that the ultrasonography should be implemented into medical spa clinics to utilize as current best practice to protect patient outcomes versus simply aspirating prior to injecting dermal fillers. When further evaluating the data, the lip area was the area that was found to have the most adverse effects in both the pre-intervention and post-intervention groups. As a provider, this did not surprise me, as the lip area is extremely vascular and involves lots of smaller capillaries and vessels, as well as larger arteries like the superior and inferior labial arteries. When evaluating this data, a Kruskal-Wallis H test was utilized. When evaluating the age groups, there was no statistical significance between each age group, but through evaluation, the majority of the patients that came to the clinic were between the ages of 21 to 40. When assessing the results of the study, again, Mann-Whitney U tests were helpful in determining the statistical significance. The Mann-Whitney U test indicated that the implementation of ultrasound technology prior to injecting of dermal filler was significant and reduced the severity of adverse events with a p-value of 0.013, which is less than 0.05 and makes it significant. The mean rank of adverse effects found in the pre-intervention group was 230.02, and the mean rank of the post-implementation group was 204.39. The data was evaluated accordingly because out of the 154 patients in each group, some of those patients received multiple areas of injections. For instance, some patients received lips and chin, while others received nasolabial folds and cheeks, and so on. It can be concluded that the implementation of ultrasound devices prior to injection of dermal fillers will reduce the severity of adverse effects. The patients in the post-intervention group did see a decrease in the severity of adverse events related to the implementation of ultrasound device. The comparison between the adverse effects related to the location of injection was assessed by conducting a Kruskal-Wallis H test. This test showed the location to be significant when related to adverse effects per area with a p-value of 0.000. The lip area was the location that experienced the most adverse effects with a mean rank of 234.65, and the jaw area was the least likely to experience adverse effects with a mean rank of 131.15. Again, this did not shock me as a provider because of the avascularity of where the jaw is usually injected in comparison to the extreme vascularity of the lip region. However, the cheek area was the subsequent highest risk for adverse effects following the lips. Compared to the nasolabial fold and chin, this area could be debated on which anatomically should have been second. However, the cheek was found to be the next highest risk from sheer volume of injections conducted in the area. When evaluating the cheeks, the transverse facial artery and a branch of the facial vein can cause those hematomas or bruising experienced. As previously discussed, the ages and genders, the vast majority of the patients included in this study were female and between the ages of 21 to 40. These descriptive statistics were utilized in assessing if there was a significance between genders and between ages. With a sample size of 308 patients, the variability regarding the descriptive statistics were well since it included such a large sample size. But when evaluating literature in conjunction to these statistics, it is a known fact that more females are interested in aesthetic procedures and enhancements compared to men. When looking at the limitations of the study, one major limitation is the inadvertent exclusion of other genders. The study considered only male and female genders. However, it did not evaluate other genders that could have affected the results. With the overwhelming number of female patients, it reduces the generalizability effect of the study. Still, when evaluating the clinic's primary patient population, females make up most of that patient population. Another limitation for this project was the cost and budget. For this study, it incorporated a budget of $7,927.06. This budget included $7,000 just in the ultrasound device itself. Other costs include printing, needles, gauze, disinfectant, payroll, and gloves. The cost of this project was extensive due to the main purpose was to implement and evaluate the ultrasound device as best practice in the clinical setting. Another limitation of this study that can be noted is the time constraints of using the ultrasound device. Patient appointments are generally between 30 minutes to an hour. However, implementing ultrasonography into practice causes a time constraint by adding time to the appointment or cutting into the time of the already scheduled appointment. This constraint made appointments challenging until working with the receptionist team to ensure that they add extra time to each future appointment. Overall, this study aimed to evaluate the benefits of ultrasonography in reducing adverse effects severity when used before dermal filler injections. The study revealed that when implemented, patients will see a decrease in the severity of adverse effects like bruising, hematomas, and vascular occlusions. The study is supported by evidence from multiple studies focusing on implementing ultrasound technology before, during, and even post-injection to treat patients with adverse effects. These studies evaluated the benefits of ultrasonography in conjunction with dermal filler injections. Patient safety is imperative when conducting facial aesthetic services like dermal filler injection, and understanding vascular landmarks like arteries, veins, and nerve plexuses is essential to prevent accidental access to said landmarks. Ultrasound technology prior has been shown, like in this study, to prevent these adverse events prior to needle penetration. The study revealed that aesthetic providers have an excellent tool for patient safety when using ultrasonography. The implications of the study focus around the benefits to practice, future research, the healthcare community, and to the patients. The study's implication is relevant in providing the groundwork for providers to ensure patient safety and improve patient outcomes when conducting dermal filler services on patients. It also provides an excellent foundation for future research to study the effects of differences in vasculature between patients and how further implementing ultrasound technology can improve patient outcomes related to dermal fillers in other areas, not just the ones listed in this study. The data provided in the study produces a great place to expand on and utilize in future research. The study's results help discuss with patients ways to improve their outcomes and ensure safety before procedures that are stress-inducing for most patients. The study can improve the safety of patients by reducing the risk of severe side effects of access to a critical vessel in the face that can then cause a vascular occlusion leading to possibly permanent blindness. Ensuring patient safety when injecting product into the face should be taken with the utmost care, and utilizing ultrasound devices will ensure that the patient remains in that high level of care and protects the patient from possible disfigurement or other adverse effects. The study gives insights into the healthcare community by providing a best practice guideline to measure providers' performance in conducting dermal filler injections for clinic owners and systems. The study provides clinics, aesthetic providers, and patients with a best practice guideline and pre-treating patients by mapping out their vasculature before injection to ensure the patient remains safe. The aesthetic industry has not always been the best when evaluated for safety with proper policies and protocols. Still, with studies like this industry can improve with an emphasis on improving such policies. Patients deserve clinics that put them first, and the implementation of ultrasound devices has been shown to improve those patient outcomes. In conclusion, from the study's findings, as an aesthetic provider and now a nursing researcher, recommend a robust implementation of ultrasound technology in MedSpa clinics to improve patient outcomes and ensure their safety. Clinics will have a learning curve regarding timing, understanding the visual difficulties of utilizing ultrasound technology, and the procurement of these expensive devices. They will need to adjust accordingly, but implementing this best practice guideline will ensure that the patients seen are being evaluated through ultrasound to reduce adverse effects that can happen post-injection of dermal fillers. Patient safety when conducting medical procedures should be done with care, and the patients should feel comfortable with their provider. Furthermore, clinics should implement this by providing patients with the education they need as to why there is a change in protocol and policy to ensure that they understand that their safety is being maintained and enforced. This education will give them a better understanding to ensure they seek care from practitioners conducting care with similar protocols for patient safety. Future research should focus not only on more areas with the utilization of ultrasound technology, but also in assessment of the key anatomical landmarks like arteries and veins. These devices can provide providers with details in understanding the anatomical differences in vessel depth, diameter, and location compared to other patients. This provides practitioners an alternative to going to a live cadaver course that is also an expense that most are unable to participate in. Future studies should also include other extenuating genders that might make up part of their patient population to ensure full inclusivity is maintained throughout the study. In regards to the Doctorate of Nursing Practice program at Maryville University, this journey and learning experience has been invaluable in cultivating my nursing research skills and abilities. I feel like I have had all the support one could have during planning, conducting, analyzing, and presenting the findings of my study, and I feel confident in utilizing my findings of the study into daily clinic practice. This process has taught me not only the key points in producing current evidence-based research, but also how to understand the results in other studies to evaluate their efficacy and quality. This program has taught me how to write in a more effective nursing researcher tone and allow me the groundwork to further nursing research. I am forever grateful for the experience and journey that I have had during these last 3 years while in the DNP program, and will forever cherish the quality experience that I have had during this program. Thank you, and I am now ready for any questions regarding my project and or presentation. Here is the list of references that were utilized for this presentation. Thank you again, and have a great day.